Good afternoon, everyone. My name is Holly Flanner, and I first wanted to thank you all for tuning in today. I know you are all very busy, which is why we created this short glimpse into Kapios and our Medicare billing solution, IOSurge. Today we are going to talk about IOSurge and how it can reduce your Medicare patient denials, which will result in a direct increase in net patient income for your hospital. All of this with, can you believe it, only 2 clicks. After the demonstration, if you request me to do so, I can provide a custom ROI model for your system, including your system's inpatient-only Medicare denials from CMS. If you have any questions at all, or you want to dive deeper into the statistics or features I talk about today, don't be shy. You can reach out to me. I'm going to provide my email after this presentation, so feel free to reach out whenever. And I also have a really great offer for you at the end of the webinar, so make sure you listen to the whole thing. The company who brought you IOSurge is Kapios, and they have a really unique business plan. Kapios is embedded in one of the nation's 15th largest healthcare systems, and that same system was just announced one of the best healthcare systems in the US. Because of this, we get to work one-on-one with top healthcare experts, and we really get to listen to those pain points that are within the industry and then partner with the experts to create innovative solutions to those problems. In this particular instance, we work closely with the physician's advisor and the revenue cycle team to look at the denials that were happening specifically within the Medicare patient population. While denials can occur at any time, experts do agree that the majority of denials can and should be prevented. This means preventing them on the front end. Hospital systems must direct their attention to prevention of claim denials to truly be efficient within the revenue cycle. At your system, I'm sure you have tools in place. However, they may be retroactive or not very efficient. Even if you do have processes in place to handle inpatient-only surgeries, the regulations are constantly changing, and you need a tool that can clearly and effectively communicate that throughout your entire system the second that those updates take place. There are a number of issues that can result in a claim denial. When a patient claim is denied, it is sent back to the hospital to begin the appeal process. However, as you may know, some Medicare procedures are not appealable. For example, if the denial was due to incorrect patient status, you cannot, I repeat, you cannot resubmit that claim. These are surgeries that must be coded and billed and documented as inpatient because they appear on the CMS inpatient-only list. If you bill as outpatient by mistake, there is no way to appeal, resulting in a total loss, and it's a much bigger loss than some systems realize. You can see from these images how much just one procedure could cost a system. For this reason, the denial from CMS never enters the appeal process because it's unappealable. Therefore, the hospital does not record it as a denial in the books, and instead they write it off. Many hospital systems never truly recognize the issue within their system because of this process. We wanted to look at these non-appealable denials and come up with a solution to make it easier to get the right patient status and code right from the beginning for Medicare patient procedures, ensuring that it was scheduled correctly and would not be denied due to incorrect documentation. So what if you did take a proactive approach? What would that look like, and what would that tool need to be? I'm sure you're already envisioning solutions in your mind, or maybe prior to talking today, you already have ideas in mind. You just haven't been able to find the correct tool to really handle this issue. IOSurge was created to prevent some of the most frequent causes of denials, such as authorization, duplicate claim or service, requests for additional information, medical necessity, claims for services not covered, limit for filing time expired, and improper status assigned. IOSurge is unique in that it can be used throughout the entire revenue cycle and requires no clinical knowledge. That means fast training and implementation. Another really important feature of IOSurge is the long descriptions. Let's take a look at a view your staff is used to seeing. This is the short descriptions, and this is Addendum B from CMS, which is a really long spreadsheet, much longer than this, that your coders are using right now to find the correct status. As you can see, I chose one procedure type, and the one I chose, all the short descriptions are the same. And here is what it looks like inside of IOSurg. When you blend the long description with the Medicare patient status, you're able to see the subtle differences between the codes, which can result in a large amount of savings when done correctly. IOSurg is used throughout the entire revenue cycle, creating consistency, all with only 2 clicks. A user can select the correct procedural code to identify specific surgical interventions quickly and accurately. They are able to verify the codes and verify that they're applied correctly during the practical process, as well as verify the appropriate inpatient or outpatient status is applied pre-procedure. You will reduce your non-reimbursements and streamline the payment process. And with only 2 clicks, you'll be able to see whether a change in surgical procedure is necessary post-op. The results we have seen have been absolutely amazing, and the feedback we're getting is so exciting. A typical system can expect a 10x ROI in the software. We actually have a white paper available on our website at www.kapioshealth.com that shows the ROI for just one hospital in Toledo, Ohio. They showed a $600,000 increase in net revenue within the first 6 months of use. That's 6 months of using it, and they already saw those kinds of results without any capital expenditures, no additional full-time employees, and very, very little training. Billing the patient under the correct status setting and billing with IOSurg has improved healthcare reimbursements as well as increased the patient and provider satisfaction. All right, now I'm going to take you into a demo of IOSurg so that you can see a little bit of what the software has to offer. IOSurg is a standalone software solution for identifying the proper CPT code and inpatient-outpatient status per Addendum B and E, which is released annually from CMS. We can embed this into your EMR, or it can act as a reference link for your system to utilize, both internally as well as outside at an outside physician's office. The search engine requires only 2 clicks in order to identify the correct inpatient-outpatient status. This eliminates the need for manual research of reference books, lists, Excel sheets, and websites. So I'm going to go ahead and type the beginning of a code. Your staff may not know the full code or the full description. So the unique thing about IOSurg is you can type as little or as much as you know, and it's going to shortlist it, very similar to Google. They'll be able to easily search the database by providing, like I said, either the CPT code or part of the description to locate the appropriate procedure. And then that billing code and patient status are communicated throughout your entire system. So here we go. As you can see, you're able to save favorites, access system notes right here, regulation and policy updates, as well as search by the system's unique keywords associated with codes. I'm also going to type part of a description. Again, I only know part of it, so I'll type that in. And as you can see, IOSurg helps me with the rest. There we go. For a full demonstration of the software, you can reach out to me, Holly, after this webinar to request a personalized one for your system, as well as I'll provide you with a full ROI for your system so that you can kind of have a really good feeling going into the demo of what type of ROI you're going to have on this software. There really is no other software on the market that will provide the same information to all of its users with 2 clicks in such an easy manner. IOSurg assists the most inexperienced as well as the most experienced providers to quickly get the right answer every time. IOSurg can be used throughout the entire revenue cycle to prevent claim denials due to patient status and lack of authorization. Saving even one missed payment with IOSurg, the solution pays for itself. And we have seen that over and over again. For tuning in today, we're actually offering a free 90-day trial no signed contract needed. I can email you information on this trial after this demo using the email that you used to sign up for the demo with. Also, my email is right here, holly.flanner@kapioshealth.com. Please feel free to contact me with any questions you have, and we look forward to hearing from you. Looks like we wrapped up about 5 minutes early, so that is 5 minutes given back to you. Thank you so much for tuning in and seeing a real quick glimpse into Surg and our company Kapios, and we look forward to talking to you soon. Thank you and enjoy your Tuesday afternoon.